Hi everyone, this is April Van Buchen. I am teaching the NSG 130 course, and I'm going to start off with my spiel about the concept-based curriculum. This is the first course, or the first semester that we've taught in a concept-based curriculum, and I know you've heard a lot about it at orientation. Each of your instructors are going to be talking about it, and I'm just going to give you my 2 cents. So, a curriculum is all the classes you have to take to graduate from a program. So our program is nursing. The curriculum is everything that we hope provides you the information you need to pass the NCLEX exam and to become a nurse. We used to teach nursing using a medical model, which meant we would teach all of the different disease processes that happen in a person's life. And to complicate it even further, we would teach about adults with all the different diseases, and then we would teach at different classes with pediatrics with all the different diseases and all the different treatments. And some of them were exactly the same. And then, to top it off, we would talk about gerontology, old people, and all the different diseases and treatments. And there were major overlaps. It was the same information. What we were doing was overloading you with information that was the same. And it maybe was great because it was all of the detail, but with healthcare being so advanced and there being so many new things, we need to simplify it and streamline it and teach you the most important stuff. And so that's where concepts came about. So many schools have changed to concept-based, and all of the Virginia community colleges have changed to a concept-based curriculum in order to educate you in a different way that perhaps simplifies things and categorizes it in a different way to give you really important information that is across the lifespan that you might understand in a better way. So we want to foster a deeper understanding. Studies have shown that concept teaching allows students to grasp and retain information. And we have bought in hook, line, and sinker. We all agree that this is the way to go, and we hope that we can engage you and you can retain this information and really appreciate it and be advocates of a concept curriculum with us. So let's start with what is a concept. The definition is on the screen. It is a common characteristic that organizes information into categories that facilitate the attainment of knowledge and skills to provide patient-centered care within the family and community. So patient-centered care puts the patient first with everything you do, and that's nursing. So you're going to hear patient-centered care all the time. So an example would be like, one of our concepts is oxygenation. Oxygenation is relevant to many health illnesses: asthma, congestive heart failure, chronic obstructive pulmonary disease, anemia, pneumonia, postpartum hemorrhage, pre-op care, sudden infant death syndrome. We used to teach all those different things, and it was really an overlap of the concept of oxygenation. So now we're just going to teach you about oxygenation in depth, and you will be able to relate it to all of these different diseases. In a concept-based curriculum, the content is framed around concepts to help the student understand it and relate it to other concepts. Exemplars are topics that we've all agreed upon, so all of the nursing programs for every course in a concept curriculum have agreed upon key topics or hot topics that we think you guys need to know to function as a nurse. And these key topics help you understand the concepts. And we're going to teach you a lot more than just these key topics. But if we cover these topics to the detail that we need to, you'll understand the concept more and you will be able to respond to nursing situations. So they're minimally suggested activities that help you within each module of a concept. So you may have a module that lasts 4 weeks that covers one concept, and you may have 8 different exemplars, which are just key topics. Think of them as key topics. The NSG 130 concepts and exemplars are listed on this slide. I'm not going to read them to you. They're all listed. So the dark green are the concepts. And you'll see these concepts in different classes. And there are different exemplars that go with each course. What we have decided to do in Middletown, and I know this class that I'm teaching, NSG 130, covers all of the students, the Fauquier students and the Middletown students. And for those of you in Fauquier, I hope to meet each and every one of you soon. And hopefully I'll be teaching one of your in-person classes next year. So you'll see me often. You're going to go into each concept, each module in Blackboard, and we have taken turns providing information about the concept and defining the concept. So you might hear my voice in some of the concepts here, and then you may be covering the same concept somewhere else. And I'll give you an example. In NSG 106, you're covering safety. But you're also covering that in either 100 or 200. So you're covering it in multiple classes. You're going to hear one of us give you a little 5-minute voiceover like this, defining safety and why is it important for you to learn. So just know, look for that. That'll help you understand a little bit about why you're covering those topics. Okay, I'm going to go into some other, I'm probably just going to show the slides, but I'll do a little talking of some of the other terms that I think are going to be important for you guys in your course of education here. Student learning outcomes. You're going to hear about student learning outcomes because we are an accredited school. We are accredited by ACEN. They do come and evaluate us. They are coming in February, and we have to have student learning outcomes. And so you'll see outcomes on your syllabus, and you'll be like, what are these? Well, these are things that we want you to know and we want you to do. And we expect it's a learning outcome, so they're measurable and they're consistent with the high standards that our accrediting body, ACEN, gives us. And for you guys as students, what ACEN means to you is that you're going to graduate from an accredited college. You're going to be able to go get work anywhere you want to, and you're going to be able to go on to your baccalaureate degree. I know it's hard to think about that now because you're just now starting a 2-year program, but we want all of you, and we're going to encourage all of you to go on to get your baccalaureate degree. If you did not go to school at an accredited 2-year college, you would not be able to get into some of the 4-year colleges in this country because your school wasn't good enough. Your school is good enough. We are accredited by ACEN, and we meet the rigorous criteria that they establish for us, and having student learning outcomes is one of them. So that was a lot for that slide. But just know, you'll hear student learning outcomes a lot. So our student learning outcomes are broken into 4 categories, and they're listed here. And some of you are probably reading human flourishing. What the heck is that? It's defined on this slide. I'll give you a second to read it. Sometimes you'll have to write papers in some of your courses that say, give me an example of how you've accomplished human flourishing. Advocate for pain. Advocate means stand up for, defend, protect, advocate. I'm representing them. Even if I don't believe in what they want. Maybe it's somebody who wants to refuse treatment, right? They want to refuse treatment, and you, if they were your mother, you would want them to get treatment, right? So you don't talk them into getting treatment. You advocate for them and support them. Does that make sense? So if you have to write a paper on how you've accomplished human flourishing, come back to this definition, okay, of human flourishing, and you can say, I helped a patient understand this, or I advocated for my patient who needed pain medication, but the physician wouldn't order it. So I called him and I explained it and I got the pain medication, or I got a different physician, or I escalated the issue. You have accomplished human flourishing. Spirit of inquiry. If you research something, you haven't learned what evidence-based practice is, but when you do, if you research anything to understand what does the evidence show is the best way to wash my hands, what does the evidence show is the best treatment for blah, 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 whatever, you have used spirit of inquiry. Just asking questions. We want you to always have a spirit of inquiry, always. Nurses are always learning. Nursing judgment. You'll hear it a lot, nursing judgment, prudent judgment. You're going to have a lot of variables that you have to weed through to make a decision with what to do. And an example would be like giving pain medication. There's a range, I can give 1 or 2 tablets. I can give 25 milligrams or 200 milligrams. So you'll have to look at their vital signs, their level of consciousness, their reported level of pain. And all these things will help you decide what to give the patient. So you're using your nursing judgment. The final SLO is professional identity, and that's one of the first topics in NSG 130. So we'll go over that then, and you'll understand professional identity. What makes you feel like a nurse? What makes you identify with a nurse? Because it's not just a job. You become someone, you become a nurse. Some other terms that I think you're going to hear often that I've thrown slides up here for to show you are next. So therapeutic communication. Just read the definition. Therapeutic communication. We're going to talk about that a lot. We're going to say you must communicate therapeutically. Caring, supportive. Think of that. So when you hear therapeutic communication, know what it means. Community. We are a community of nursing students here. Whether you're in Fauquier or whether you're in Middletown, you're a community with each other, both campuses, and you're a community together. You're a healthcare community, so home health, ICU, ER, it's one community, and the community in which you live. So there's all kinds of things that make a community, and you're going to hear community with that term a lot. You're going to hear patient-centered care from every one of us here in this school. So you need to understand what it means. The patient is who you're caring about. It's their wishes. It is their care. Everything circles around the patient. They are the center of everything that you do. Patient-centered care. You're going to hear scope of practice. You may hear people like, okay, if I am a nurse and I am being asked to do a surgery, that's outside of my scope of practice. Many of you are nursing assistants. You're certified nursing assistants. If somebody asks you to give a medication, that's outside of your scope of practice. So scope of practice are the guidelines that clarify your role, what you're allowed to do. And there are job descriptions in the hospital, but those job descriptions come from the American Nursing Association. They come from the state. So in one state you may be allowed to do something, in another state you may not be allowed to do something. So you need to know your scope of practice, and you'll hear that phrase a lot. Okay, that ends this initial recording. I hope this was educational for you and helpful. And before each module there's going to be a concept overview. And if you've heard one-on-one class, you may see it at the beginning of another class, and just watch it again as a refresher. So become very familiar with the concepts. Thank you.